Hello, everyone. My name is Shanae Penn Williams, and I'm a Senior Programs Officer in Birmingham Public Health. And welcome to a Bolder, Healthier Winter webinar. These are a series of practical resources to enable community leaders and professionals to support communities in Birmingham to stay healthy and well this winter. You can find the recordings of these on our website. This week, I'll be covering mental health, looking at how we can take care of your mental health and support others in the community. And the best place to start is, what do we mean by mental health? Mental health is a lot like physical health. Everyone has it, and it's very important that we take care of it throughout our lives. Our mental health affects how we think, feel, and act. Mental health can affect many things, such as how we approach making decisions, handling challenges, relating to others, and generally doing the things that we need to do in our daily lives. Mental health can go through periods of ups and downs. And when we experience poor mental health, it can feel like the way we think, feel, and act are becoming difficult to cope with. And it can be hard to handle our daily lives. Poor mental health can make you feel a whole range of emotions like tired, sadness, helplessness, burnt out, angry, agitated, overwhelmed, stressed, and worried. It can feel just as bad as a physical illness. However, whatever you're feeling, it's important to remember that you're not alone. Mental health problems affect around 1 in 4 people in any given year. They range from common problems such as depression and anxiety to rarer problems such as experiencing psychosis. This is when we hear things, see things, and believe things that aren't shared by others. Now I'll be going through more in depth on the common illness of mental health and just what the cause of it and how it affects us. So let's talk about anxiety. What is anxiety? Anxiety is what we feel when we are worried or afraid about a situation. It's our body's natural response to things we perceive as dangerous and threatening. However, if these feelings are disproportionate to the situation and are very strong, regular, or hard to control, then this can be an anxiety disorder. The symptoms of the anxiety disorder is as follows on the slide. It's frequent, uncontrollable worry and dread, feeling tense, restless, irritable, and muscle pain, fast breathing and heart rate and tight chest, headache and feeling spaced out and disconnected, feeling nausea, dizzy, and sweating. However, there are other symptoms that we sometimes don't associate with anxiety, such as tightening the chest, digestive problems, and problems sleeping. Now let's talk about depression. What is depression? In the same way in which anxiety isn't just worrying from time to time, depression isn't just feeling down sometimes. Depression is often very difficult to describe to someone who hasn't felt what it's like. It isn't just feeling sad. Some people with depression say it's like being unable to feel anything at all. People can feel worthlessness, very distant from the world, and things that used to bring them pleasure doesn't work anymore. Sometimes people describe this as like living behind a glass wall. Depression can also affect your energy levels, feeling tired and unmotivated, sometimes sleeping too much, sometimes being unable to go to sleep at all. Some people describe it as a heavy weight, even a pushing on their chest, or a feeling of meaningless or pointlessness. People often experience physical symptoms too that might not known or relate to unexplained aches or pains, a low sex drive, or changes either increase or decrease in appetite or weight. But the main treatment for depression are talking therapies, such as counseling or cognitive behavioral therapy and antidepressants, medications, which may help relieve the symptoms of depression. However, there are lots of things people can try. Stay in touch with people, however hard this may feel it can be. Doing some form of exercise, even if it's just walking, not drinking too much alcohol, as alcohol is actually a depressant in itself, and eating healthily and nutritious food. Forward thinking Berman has access to a lot of resources that may help as well, such as peer support workers for people up in the age of 25 and over, and there are helplines and other resources available on the website to support this webinar. These comments on the presentation on the slide at current is just what various people has described what depression is to them. I read too, just to literate how people perceive and understand depression differently. When I was younger, I described it as feeling as though I had been hit by a bus. Not that it was painful, but that it was the huge weight on top of me that I couldn't remove. People were always saying I should do this or do that, but they couldn't understand that I was pinned under it and couldn't get out. Depression feels like a weight on my chest, where it brings me down everywhere I go. I wanted everyone to know how I felt, but I didn't know how to tell them. Now let's move on to loneliness. What is loneliness? Loneliness is characterized by feeling isolated and alone, and not being able to experience the social interaction and relationships that we desire. Some people feel lonely even when they're with other people or live in a big city. Loneliness is a common experience, and the short days and cold winter can be particularly isolating over the winter months. This has been even worsened over the last few years during COVID-19 pandemic, where 7.2% of people in a 2021 survey reported being always or often feeling lonely. Research has also shown that loneliness and isolation can be just as harmful to our mental health and well-being as obesity and smoking. Loneliness can be damaging to mental health, and poor mental health can in turn be an isolating experience. Some groups can be especially vulnerable to loneliness, such as people estranged from friends and family, single parents and carers, people living with chronic illness, and people with low income or experiencing unemployment, as well as people experiencing discrimination and stigma based on their race, gender, sexual orientation, and disability. But there's help out there to support individuals going through this. So if you're feeling lonely, there's a variety of support available from telephone befriender hotlines and peer support groups, both online and in person. Information will be shared along with this video that might be able to help you as well. As well, there's details on the slide here showing that Birmingham Minds has a directory of help for peer support that you can find within your area, as well as Age UK as well with a telephone befriending service. Now let's move on to bereavement. Bereavement occurs when we lose someone or something that is important to us. We can also experience grief when we face job loss or the end of a relationship. COVID-19 pandemic as well has exposed many of us to a disproportionate amount of bereavement, and lockdown restrictions have denied us the opportunity to grieve these losses in a healthy way. This can have a significant impact on our mental health, leading to complex grief. Bereavement can also lead to us to experience a whole range of emotions as we process that loss, including feeling of shock, numbness, overwhelming sadness, anger, guilt, confusion, tiredness, and exhaustion. These emotions are all a natural part of the grieving process. However, if the symptoms of bereavement are becoming overwhelming and you feel you are struggling to cope, there are lots of options that you can try for support and advice. A lot of bereavement service will be shared with this video. As well as you can see in this slide, there's a natural service for bereavement support and a local service for bereavement support that we can tap into as well. So what can you do to look after the mental health of yourself and others? There's a lot of things that you can do to take care of your mental health and to support others with their mental health too. These tips can help you maintain good mental health, might be able to help you if you feel like you're struggling. These tips we'll go through in the next part of this webinar include keeping a diary, planning for difficult times, practicing relaxation activities, talking to someone and seeking peer support, taking care of your physical health and reducing your social media usage. So let's begin. Practicing journaling and planning ahead. Regular writing a diary with your thoughts and feelings has been shown to have huge benefits to our mental health and well-being. It can help us make sense of things that are happening in our lives and express how we are feeling about them, particularly when we are feeling overwhelmed. Journaling can be an excellent way to vent and unload. It's a useful way to regulate our emotions. We can note down any particular physical and emotional symptoms we are feeling and any trigger that might have set it off. There are a lot of resources with advice on journaling techniques you can practice. Plan ahead for hard times. This is important that we plan ahead and anticipate things we might experience in the future so that we can prioritize looking after our mental health. We can rearrange activities that we find difficult and ensure we make time for things we enjoy and help us relax. Taking time out for self-care to reflect and recuperate for the day is not selfish. It's essential for your mental health and well-being. Now let's talk about the importance of talking and peer support. There can be a lot of stigma around talking about your mental health. But the more we talk about mental health as something we all experience, the easier it is for people to reach out for help and discuss how they are feeling. It is important that we are present, persistent, honest, and understanding in encouraging people to talk. We all know that it's good to ask how someone is doing, but it's often hard to know what to do when they say they are struggling. Fortunately, there are lots of resources and options for support. If you are concerned about your mental health or someone else's, speak to your GP. You can speak to your local GP about your mental health, who can signpost you to relevant support. Your workplace. It is the responsibility of your workplace to create an environment where mental health is discussed and supported. Peer support groups. There are plenty of groups where people with similar lived experience can meet online or in person to discuss their challenges or do activities such as gardening, sports, walking, cycling, mindfulness. Walking centers and culturally sensitive support concerns about lack of cultural understanding and language can often be a barrier to people seeking mainstream support. However, there is a broad range of groups and services in Birmingham for people of different faiths, ethnicity, sexual orientation, and who do not have English as their first language. Most importantly, speak to someone that feels safe talking to. Links to a broad range of support services and resources will be shared along with this video as well. So let's talk about the importance of relaxation, meditation, mindfulness, and prayer. Think about learning different relaxation techniques that you can use to manage your stressful level. One option could be to practice mindfulness through meditation or prayer. Whether you are a spiritual person or not, taking time to be present and examine your mind can have enormous benefits for your mental and physical health. While mindfulness can be taught in person, there's a range of free and paid apps and resources out there that you can utilize in your daily routine to help you manage and cope with stress or overwhelmed within your daily lives. Now, the beauty of mindfulness is that you can do it anywhere, anytime. So why not we try making this a part of your daily routine? So let's talk about taking care of your physical health. Taking care of your physical health is particularly important during the winter months. As well as keeping fit and helping to prevent illness, it can have a huge difference to your mental health. It is recommended that the average adult gets between 75 and 150 minutes of exercise per week. However, physical activity does not have to be vigorous. Exercise like sports or going to the gym, going out of the house for a short walk has been shown to significantly reduce risk of diabetes and cardiovascular disease. But it also has many mental health benefits, especially if you are able to walk in green spaces with other people. It helps to reduce stress and anxiety, improve our energy and alertness, improve our self esteem and confidence, improves overall mood and symptoms of depression, reduce risk of dementia and memory loss. The Active Wellbeing Society deliver a broad range of peer support groups running physical activities for all abilities across Birmingham, including walk and talk sessions and group cycling. Looking after your physical health can include basic self-care like getting washed, dressed, get out of the house every day. Ensuring you maintain a healthy diet and get enough sleep is also an effective way to keep mentally healthy. Let's talk about social media and the impact it has on our mental health. The unrealistic expectations set by social media can lead to feeling of low self-esteem and needing to pursue perfection, which can manifest in anxiety disorders. Using multiple social media platforms simultaneously has been closely linked to symptoms of social anxiety. It's not always easy to tell why you're feeling down when you're online. It's important to remember that social media is designed to hold our attention for as long as possible. And it's not always the things we enjoy that we do. Young Minds have some useful tips on how we can change our social media to use it to have more positive time online. Following advice is unfollow or mute accounts that annoy you, upset you, or take you too much of your time. You don't have to be on every social media platform. Try deleting social media app from your phone for a week and just see what happens. Limit the time you spend on social media before you go to sleep and when you first awake. Before you post a comment, ask yourself whether it's positive for you and people who will see it. Use the emoji slide found on Young Minds website to consider how your social media feed makes you feel. The link is also on this slide. They can take you to the social media site for more tips and advice how to be mentally positive online. So what do you do in a crisis? If you're in a mental health crisis, there's a few things that you can do. For example, Birmingham Mind operates a 24/7 mental health hotline that you can call whether you need support without being known or registered to the service. Number is 0121 262 3555 or Birmingham and Solihull Urgent Mental Health Helpline at 0800 915 9292 for advice and support. Just remember these are 24/7, 7 days a week, and can be used whether you're known to service or not. There's also an email, help@birmingham.org, or you can get in contact for a web chat service by Helpline Birmingham Minds. And there's also a broad range of local and national services that you can use for support on the topics discussed today. The contact details for these organizations will be shared along with this video on our website. Thank you everyone for joining me today. I hope you have a bolder, healthier winter.